campaign has been a phenomenal success in providing resources for a wide range of activities and projects that we've had in the organization.
We are incredibly grateful to the community for providing the startup funds essentially for the True Family Women's Cancer Center. One of the things that we focused on as we designed the Women's Cancer Center was looking at how can we enhance the patient's experience of care.
The new facilities are so beautiful, and when you're going through cancer care, which is as difficult, it really is nice to have brand new, beautiful facilities.
Patients are delighted to be able to come essentially to one facility and find a whole spectrum of care available to them.
Where there's just a high level of collaboration amongst the caregivers, and whether that be the doctors and nurses, but farther beyond that, nutrition services, genetic counseling, and even social work. And because cancer doesn't sort of hit you when everything is going well, it's usually there's lots of other things going on in your life. And that's one of the things I think that's really remarkable about this center, is bringing all of those services together and having them available for patients. And I think that the Seattle community is really going to benefit from that.
I feel really honored to be able to do the work that I do. I get to work with women who are going through a difficult circumstance, and I get to understand their resilience and to help them as they forge ahead through this obstacle that's in their life. The True Family Women's Cancer Center belongs to the community.
I'm very happy to be a part of the Seattle community and to be part of this part of the country that really makes centers like this possible for patients like me.
When our physicians, our staff, and our patients feel engaged, we have a community that gives and supports services in a way that actually makes you feel very, not only proud, but makes you want to give a little bit more as well.
The Gossman Center is a beautiful 6,000 square foot simulation center on the First Hill campus. When it was originally thought about, they really thought about it in terms of pediatrics and perinatal. But as we got more into the work and really realized the value of simulation to all facets of the hospital, we've now encompassed the entire system in what we do. So we've actually changed the name now to the Gossman Center for Advanced Healthcare Simulation. The campaign has allowed us to do so much. First of all, it's brought Swedish the resources to implement simulation, which is #1 in terms of patient safety. The exciting part is that we're learning more about it every day. We're learning how beneficial it is every day. We're learning about how it breaks down the silos between nursing staff and physician staff and the ancillary staff, because we really bring the full interdisciplinary teams together. The donors and the community involvement has allowed us to gather those resources, to expand our program to Swedish, all of the areas of Swedish, and out into the community. All of us at the Simulation Center would, from the bottom of our hearts, like to thank the community for the opportunity to bring simulation to Swedish.
The MS community has been trying to create a center like this in this region for well over a decade.
It caters to accessibility and being able to do what you have to do without having to worry about trekking across town to go see your physical therapist, or even just trekking across the hospital.
It's a major undertaking, and it's nice that an organization as large as Swedish was willing to take this on. It's financially challenging to take care of these patients, and the fact that Swedish recognized that there was a need in the community and was willing to step up and contribute to this really says a lot about their support for people in the Pacific Northwest. It's very helpful for us from a treatment side to have all these resources right here, so I think it's good for both the patients and for us.
The best part about it is that it's a sense of community outside of a waiting room for a doctor's office. It feels like you can go in and just sort of be there.
It's been very rewarding to see our charity care and community benefits receive the support that it's got.
In the state of Washington, the community health centers had no place to refer their specialty patients, and these individuals were either not receiving care or showing up at the emergency room late in their condition. The Swedish Community Specialty Clinic is one effort to get those dollars under control. We are keeping people from the emergency room. We're getting them to the appropriate services and actually reducing costs throughout the whole system. The campaign has allowed us to consolidate our services under one roof to bring together several programs. We've increased the number of volunteer physicians in our clinic from a handful now to 300 physicians. We are approached all the time by people with ideas of how we might expand our services. We heard from the dental community that it was very important to address the dental needs for patients in the state of Washington. Many of our dental patients were seeking their dental care in the emergency room. The campaign has allowed us to be innovative, creative, and set new goals that several years ago would have been very difficult to reach. We're serving almost 2,000 patients in the medical side, and with the development of our new dental services, we've now seen about 600 patients this year, and we will be expanding that to up to 1,500 patients next year.
It's been just a phenomenal success, and the number of patients treated has skyrocketed.
I would like to express my thanks to the community for building this incredible facility for women. I'm very appreciative to those who've donated at every level in this campaign.
I would personally like to thank the campaign for giving me the opportunity to expand the vistas of healthcare for the underserved and the uninsured, and giving so many opportunities to our physicians who love to give back to the community, to volunteers who give back to the community, and for giving us all the opportunity to do what's right.
Swedish needs you as much as the community needs Swedish.